Okay, so as you can see, the straps are going to be on opposite sides so that you're able to properly affix them after we place the brace. Okay, so the brace is flat. We're going to place the brace underneath the side that you're placing the brace on. Okay. Okay, so the first portion is...
And you're organizing that so that the knee hole
Yes.
is where my patella will be.
Correct. So you can
Okay.
feel the patella is right here, the center of it, but you can always kind of see, okay, now it's in the middle. Then you're gonna fold over that first portion of it. Make sure it is snug because then it'll prevent any sort of slippage. And then that lower portion as well. Okay, so you might have to, put some tension on that. Okay, then overlapping the straps, and then same thing, you're kind of reinforcing that sleeve in place.
So you notice you're not really pulling hard on that. It was just the first two flaps you pulled hard on, and then the straps
Yeah.
you're just securing, making sure, yeah.
Because it should be tight enough, but this is basically securing that sleeve in place.
Yeah.
And then, again, something to note, that label should be on top. Okay, so that's when you know that the right position of the brace. Okay, so Marie, we're just gonna have your leg on here, and just relax the leg
Oh. Oh.
as best as you can. Okay, so ideally you want most of the leg to be supported so the knee doesn't feel vulnerable.
Yeah.
All right.
Nah, I'm not gonna be ideal.
Let's see how you feel. I'll adjust if we need to. Okay, Marie.
Okay.
But we're putting it on so it won't hurt when you stand up.
Right.
So it's a little uncomfortable now, but it'll keep you from as much pain later.
Okay, so just to.
That's bad.
It'll stop in a minute, yeah.
All right. Leg is supported. Now the sleeve is placed underneath so that we can now fold this over. So again, this should be centered so that the kneecap is in the
Right.
center. Okay, Marie, just watch your hand for one moment, please.
Sorry.
It's okay. So Marie, this is going to feel a little tight. I'm gonna have to try to tighten this over. Come across.
Oh my gosh.
Very good. So that feels tight, but it's comfortable, right? Okay. Same thing with this bottom layer. So as long as it's affixed, okay. In her case, okay, those straps are gonna come across to just reinforce. Okay, and I'm just doing it, laying it over. You don't have to pull it very tight, just affix it enough that it's keeping the sleeve together. And then the same goes for the upper portion. Okay, and again, that label should be on top.
Perfect.
As long as you're feeling that that kneecap is in place.
Ultimately, we see the two hinges on the side
Yeah,
here.
so this one, for instance, this one looks like it's rotated a little bit that way. You can
Yeah.
see how
Yeah.
it's this way, but this is actually much better
Yeah.
on this side.
But do you need to redo this
Yes,
one?
I'm gonna
Okay, so
redo it.
you're gonna redo that
Yeah.
one, and
I'm
that
basically
way.
just gonna redo it so it's just central. That's
Okay.
it. All right, Marie.
Oops.
Okay.
Oh. Oh.
Okay.
Yeah, sorry, but it'll.
Yeah.
We're trying to get it so it'll
Make sure that
actually.
it's-
You're not in big pain later. We're having
Okay.
a little pain now. So
Okay.
we're just readjusting this because it wasn't quite in the right place. It got twisted a little.
Okay, so here's that kneecap.
Wow.
Yeah.
Wow.
This one.
Why did you pick that one?
Okay. Good. Okay. Now it's in place. You can feel kneecaps in the middle. I'm not going to tighten those ones yet. And then the last one's on the top. Okay.
Now, how, are you concerned that that's on the side?
No,
Okay.
it's just more that it's on the top. That's
Perfect.
pretty much it.